Now, let's talk about the plight of healthcare workers. The KMPDU has issued a strike notice. Nurses have also done the same. Today, the Kenya Union of Clinical Officers did issue their 14-day strike notice. They have listed a number of demands that you want implemented. 14 days will elapse the same day that doctors will also be going on strike unless their demands have been met. We are in a situation where the country is faced with COVID-19. Not just medics are, getting infected, but Kenyans too are getting infected. Should we be in a position whereby no one is able to take care of the other? Where do we go from there? Because all we have had are demands. Kenyans issuing their demands, healthcare professionals also issuing their demands, and the government urging everyone to stay calm and work together towards fighting this pandemic.
Thank you, Kabaso, for having me. For the viewers, my name is George Gibore. I'm the General Secretary, Kenya Union of Clinical Officer. Indeed, as you have stated, it's very clear that we have issued a 14-day strike notice, and this is in understanding that we had given a demand later 7 days prior to today that the ministry meet our demands, and these demands are just such of a priority to save the human life, and more specifically the healthcare workers, and by extension now poor Kenyans who seek services in the public sector. Unfortunately, our demand met a deaf ear, and no one listened to us. And that is why we are actually not happy that the government never wanted to have even an ear and come on the table. We discuss on how we needed this one be done. Because one, we are talking about now the second wave, which is wrecking the health sector in the country, and you must be able to go from the date that actually we announced that we had flattened the curve for the first wave. We had lost just a few healthcare workers, and actually, fortunate enough, by then we had not lost even a single clinical officer. But today, we are talking of 7 clinical officers who have lost their life. And the attributing factors are a number of. One, we feel that there have not been adequate supply of PPEs. And 2, we feel that even the PPEs that we are given are substandard and are not in tandem with what the ministry has provided on their policies. For instance, I need to give a good example for purpose of understanding that the ministry has provided for all the healthcare workers who are seeing patients and doing even aerosol exams should be able to use an N95 mask, should be able to have at least a face shield or goggles to protect their eyes, should be able even to have a cap to cover their head. They should be able to have a gown that they put on. They should be able to have also a boot. All these things, 99% of a facility, there is nothing. The only thing that we are meant to have is actually a surgical mask. The surgical mask, by virtue of the WHO prescription, we are allowed to use a surgical mask, provided we are able to use it the way it's supposed to be. A surgical mask is supposed to be used within 3 to 5 hours at most. But our healthcare workers who now have left only with this only one item to protect themselves are forced to use a face mask, a surgical mask, for over 24 hours. This is actually an exposure to all the healthcare workers who are using this, including other Kenyans. Need to know that once you are in a place where you are able to touch your mask without a proper sanitization and the wash of your hand, you are able to you actually increase the chances of exposing yourself to the virus. And this is one of the contributing factors that we have talking about, that the government must be able to ensure that this is done. And remember, Kabaso, what we were calling is that the government have announced that they have billions of PPEs. They have PPEs worth billions in the KEMSA. And we have called that the government must release these PPEs at whichever cost to go and protect the healthcare workers. They have not done that. The other thing that we have consistently advised the government is to ensure that those who are within the bracket of the vulnerable group should be actually be allowed to not to participate actively. That's to mean that they should be able to be released from, not to be released as such, but to be excused from active duty. And however, when we raise this issue, we have found that the government continue intimidating these officers. Once they apply that they can be given, can be exempted from active duty, they are given a threat that they will be fired.
We have two levels of government. We have the national government,
yes,
and we have the county government.
Yes.
The health function has been devolved.
Yes.
Your grievances, are they directed to the national government or to the county government?
The problem we have is at both levels. And it should be remembered, Kabaso, because we know that our leaders knows that we always forget very easily. When the COVID-19 case started, the ministry said and announced that the management of COVID-19 must be done centrally. That's why we have a central body that was established by the president involving the county government that runs and coordinates all the management and actually came up with the policies that are supposed to help us and streamline the management of COVID-19. And that is why all the government, that's the Minister of Health and the county government, are actually the culprit of all these issues that we are raising. I was giving the list of the people who are among the vulnerable, and I have mentioned specifically that one of them are those who have 55 years of age and above, and it's painful to note that including a clinical officer that we lost in the eve of today was 58 of age at KBC level 5. And the other one are those who are pregnant and those with pre-existing conditions and diseases. These people should be able to be exempted from active duty. We have gone through the list of those who we have lost, more specifically the clinical officer, including even other cadres. It is very clear that the people that we have lost in the health sector, actually a majority of them are under the vulnerable group. Have we heeded to advisory of the WHO and also consistently as the Kenya Union of Clinical Officers have been calling for the exemption of these people? I want to believe that we'll have reduced this death, the number that is rising, and to some extent saved life, because we say that this is avoidable and we can be able to do that. And I was listing a number of issues that we feel that the county government have not been able to address, and I mentioned among those. And even during this particular time, as we continue suffering and the number of infection continue going high, the healthcare workers have been left to foot their own bill without the support of the government, because as it is, the NHF announced that they are not catering, and indeed they have never catered or rather footed any bill for any healthcare worker. We have been left to do harambes to foot the bills of our colleagues who have actually gotten sick and hospitalized. And to some extent I can mention of one case that we had of one of us who is actually a nurse who succumbed at KU, and we were forced to pay. They retained the body until the money was to be remitted to the account, over 250,000. So this is the painful moment and the painful things that the healthcare workers are going through. And now we are calling that the government must provide a comprehensive medical cover and indeed provide for a life insurance for the healthcare workers because of the riskiness they are involving. In any case, these are the foot soldiers, the front soldiers that we are using to combat this killer disease. And it will be only reasonable for any government to prioritize such issues that we are raising so that we are able to move forward. That indeed we feel safe even when we are working, we feel supported even when we are working. We are also calling that once the government is also doing this, they must be able to pay healthcare workers in time. We have people who are engaged during this COVID-19 who are the UHC staff. They are named as UHC staff. They are going for 6 months without any pay. And this is a time when we are encouraged to ensure that we are feeding properly, ensure that our immune is well supported.
Right.
And you are subjected to 6 months without pay. What are you telling Kenyans?
The list is long. The list is long.
But as you'll see, Kabaso, as much as it is long, these are the reasonable things that we want the government to do, because like payment, you cannot expect anyone to continue working without pay.
Doctors have sought audience with the Ministry of Health. They have met with senior government officials over their grievances. They also have a strike notice which is active.
Yes.
We haven't had any announcement that their demands, or some of them, have already been met. Who have you sought audience with? Because we have not seen anywhere clinical officers meeting, let's say, the minister or the cabinet secretary in charge of health.
Kabaso, that's right what you're saying. I think we have a government that always they choose what to do when they believe is right to them. They have never prioritized and considered the issues of health to be such as serious. I will be feeling that indeed if the government meant well, on Sunday when we issued the press conference and they followed up actually serving them with the same demand that we provided. The demands that you are seeing here are the same demand that we provided since last Monday. None of them even looked and considered to have a meeting with us. We were seeking to have a meeting with them. And indeed, we made a clarion call to the president that he need to convene a meeting with the healthcare workers, the leadership, to discuss the issues that are affecting the healthcare workers. Because I want to assure you, today, if you have all the infrastructure, you have all the requirement in the facility you need, the medicine and everything. Once you lose a healthcare worker, if you do not have a healthcare worker in that equation, then everything is down. Now we are saying that these are very crucial people and they must be involved. We saw that we have been seeing the government and most specifically the president meeting the political class, discussing on how we were going to combat the disease. We have not had a chance to meet the president, not even Mutahi Kagwe.
So
they have become unavailable for us. And that is why we feel that our issues have never been considered.
Where is the gap? Because for you to see the president, there is a protocol. I believe that also for you to see the cabinet secretary, there is a protocol as well. Is there someone somewhere who is stopping you from seeing
protocol in
the
this
president?
Country, but those are a way of actually ensuring that you are deterring people from reaching where decisions are made. We are talking about people who are making decisions. So Mutahi Kagwe should be active enough, proactive enough.
Who has blocked you from meeting the president or the cabinet secretary for health?
I think I should be able to say that we have the ministry that need to streamline that the people who should actually be able to carry over all these issues and organize meeting between them. If they cannot make decision at that level, they actually refer the issue to the president, because we are saying these healthcare workers need to be motivated. If they cannot make a decision on how to motivate healthcare workers, it is only the president, then that is where the rubber meets the road.
I would really love to know who at the Ministry of Health is blocking you from meeting the cabinet secretary, or who in the office of the president is blocking you from meeting the president, because some of the issues that you're raising are really genuine, and we see in the media medical workers are losing their lives to COVID-19. But we'll talk about that. This interview continues shortly. I am seated here with George Gibore. He's the General Secretary of the Kenya Union of Clinical Officers. They have issued a 14-day strike notice 9 demands that they want met, or else they make good this threat. Don't go anywhere. We'll be back shortly.